Can you all see my screen?
Yes. Okay, go on.
Okay, you can see my screen?
Yeah.
All right. Okay, so today I shall be talking, can you see my video as well? Even is my video coming out?
It has not started yet.
Okay, all right. So it's not showing. Okay, today I shall be talking about preventive health care and from a surgical perspective. For some reason, sorry, the video is not coming out. Is the video showing?
No, it's not.
Hmm?
No, it's not.
Okay, hold on. Huh? Okay.
No, can't see the video yet.
Okay, never mind.
Don't hear anything. No, you're talking.
I think you need to, Jivan has to
make you a host.
Okay, all right. Now you can see me?
We can see you.
Okay, all right. So today I shall be talking about can you put my screen as the main screen? Can you all see me as the main screen? Okay, all right. Fantastic. I shall be talking about defining preventive healthcare and what is it about. Basically, I shall be telling you about my journey from where I was to where we are and what we do. Basically, I'll start off with who I am. What are the things that we do? Why we do the things that we do? And how we do it. So in case you do not know, my name is Alwin Lum, for those who have never met me before. All right, and I think I represent both Magnitude Healthcare, and I'm also the medical advisor to the Vaccination program as well. So I think before everybody gets bored of my face, I shall take myself off and go straight into the presentation. All right. So before I begin, question is, who am I? I did my MBBS from IMU, and I graduated more than 12 years ago. And I then proceeded to do my master's in surgery. And before I joined Magnitude Healthcare, I was the senior registrar, I was the chief registrar, the Department of Surgery. And that was the start of my journey. And on top of that, I'm also a member of the Royal College of Surgeons. And if you wonder, yes, that's the same Royal College of Surgeons that created some controversy with No Hisham previously when the question did arise on whether it was a Illuminati establishment or not. So yes, I'm a member of the Royal College of Surgeons, and I also did my master's in surgery. And before that, I spent 10 years in the Department of Surgery in Hospital Tuanku Jaafar, Seremban. After which we decided to focus on preventive healthcare, and at this moment in time, I'm not practicing surgery anymore, but I focus myself more into the corporate aspects of healthcare and focusing on preventive healthcare. And that is why VaxiPlus as a program interested me when the program was being brought into fruition, because it actually brought out many aspects of preventive healthcare that are not being mentioned in mainstream healthcare establishments, including insurance companies and including your other healthcare or so-called wellness programs and establishments. So today, what I shall be telling you is to join me in my journey on where we are today and how I got there. In order to understand what preventive healthcare and why I chose to focus on preventive healthcare. Now, if you look at your surgeon, a surgeon is somebody who, in general terms, tries to solve problems. You have an injury, he fixes the injury. If you have a cancer, he removes the cancer. You have infected gallbladder, he removes the gallbladder. But having spent 10 years in the Department of Surgery, there are many things which has made me realize that there are more to solving problems that already arise than meets the eye. So in order for you to understand this, I'm just going to share with you a few pictures from the journey that I have encountered. Now, in my training in general surgery, I have actually gone through possibly 7, 8 different departments. I went through neurosurgery, general surgery, pediatric surgery, children's surgery. We did a bit of plastic and reconstructive surgery, minimally invasive surgery, brain surgery, and most importantly, vascular surgery as well. So I'm just going to share with you a few pictures from my view on how things have been. That is a picture of a very infected gallbladder. You can see the pus. If you can see the pus there, that's a picture of a very infected gallbladder. And this could have been avoided if the gallbladder was removed earlier, before this problem started. That you can see is a picture of the vessels of the brain, and the swelling there is what we call as a Barry's aneurysm. The swelling that you can see here is the Barry's aneurysm. The Barry's aneurysm is what causes is a swelling of the blood vessel in the brain, and that has caused the death of many young people. You think it is a stroke, you call it a stroke, but it is actually a malformation in the brain that can be sorted out, or can be treated if it was detected early. People would have mild headaches, and it could have a surgery could have been done to burn that swelling before it ruptures. Rupturing of that swelling there causes death 70% of the time, and this is what we call as a blood stroke or a hemorrhagic stroke. There you see is a picture of who has had similar. This is due to high blood pressure. The white color points inside the brain is actually a ruptured blood vessel there. So this is another hemorrhagic stroke, not because of a malformation, but because of high blood pressure. So this again can be treated if the blood pressure has been monitored. This is a picture of a polyp in gut, which we see when we do a scope. When you put in a scope into the esophagus, this is a tumor that we see growing into the gut. That's another picture of the esophagus. Now, if you can see here, this is an ulceration. This is a picture which we did before we banded it. There's an ulceration and it's bleeding. This patient had liver disease, and the liver disease had caused the swelling of the blood vessel near the stomach, and if it ruptures, this patient actually bled and he died actually from this. This is a young patient who had, if you see the intestines are red and black, the gut actually was strangulated. It was twisted on itself. Sorry, this wasn't a young patient, it was an elderly patient. It twisted on itself. It was all because there was a mild abdominal pain and it was shrugged and missed. And ultimately, when we opened up the whole small intestine, that is the small intestine, the whole small intestine was black and red and all and dead. So we had to remove quite a fair bit of small intestine from this lady. And this is a surgical site infection. This is an infection from mesh. This gentleman actually had a hernia coming up from his umbilicus, and after he underwent surgery, he got infected. Because of sanitation at home, he came back with an infected mesh, and finally, you can see the intestines are protruding from that mass. So those are the pictures which I have been seeing on a regular basis for the past 10 years. Malaysia is actually a pretty good developing country. We have sufficient people who are educated, but yet we have a lot of people who are surprisingly from the middle income group, who have no control over their own health, who have no control over their own life, and only seek medical attention when they are sick. And when I mean sick, I meant absolutely sick. And because of that, we actually end up having to treat, and many treatable diseases end up going untreated, and many of them ended up dead, all because of the lack of knowledge and the lack of education in terms of preventing this problem. So these are one of the few reasons why when I joined the corporate sector, I actually decided to go into preventive healthcare, an area which not many people address and not many people know. And I'd like to focus on the surgical aspects of preventive healthcare, which is what we are going to talk about today. Now, when we talk about preventive healthcare, what do we always talk about? We always talk about vaccination. Oh yeah, by the way, that's me. That was my COVID-19 vaccine. We talk about screening. We talk about taking blood, doing blood tests. We talk about doing blood profiles, checking your liver function, kidney functions. Yes, of course, they are very, very important aspects of it. We talk about things like mammogram. For a lady, when you hit 40 years old, the first thing you should always do is a mammogram. And then after that, every 3 to 5 years later. And the importance of mammogram in the management of breast cancer is so huge that Malaysia, in fact, has got a mammography and breast screening module in place today, and is given and is done free of charge for all citizens in Malaysia. So mammogram plays a very important role. So these are the things that we think about when we talk about preventive healthcare. But let's not forget that vitamins and all your supplements are also part of preventive healthcare. Don't forget that. And they are a very huge part of preventive healthcare. And they're such a huge part about it that many different companies, such as, I will not say, but many direct selling companies make a fortune out of it. Your facial products, the things that you use to wash your face, to moisturize, and to cleanse your face, all of this actually constitutes preventive healthcare as well. But on top of that, colonoscopy is a very huge component of preventive healthcare, which brings us to our next part, which is interventional preventive healthcare. What is interventional preventive healthcare? Now, those parts of preventive healthcare are things that we hear about all the time. Vaccination, screening, mammogram, ultrasound, supplements, healthy living. But today I'm going to focus a bit more on the less known aspects of preventive healthcare. If you see here, this is a picture of the gallbladder. This is the liver and the gallbladder, the pinkish color thing connected to the liver by 2 strands. That is your gallbladder. And this gallbladder actually looks pretty healthy. I think there are a few stones in there. But this gentleman actually had pancreatitis. He had a stone that was in the gallbladder that came out and blocked the bowel passage. So this is another aspect of preventive healthcare. Surgical preventive healthcare, where the removal of the gallbladder is a form of prevention of severe complications from inflammation of the gallbladder or gallstones. That, if you see the picture on the left-hand side, is a picture of a lung. Not any lung, it is a 6-month-old baby's lung, which has fibrosis or it was hardened up from birth. The removal of the lung, although not necessarily at that point, was essential and necessary for him to continue growing. So, and if you see the surgical field on the right, what you see inside there are ping pong balls. This procedure is what we call as a ping pong ball pompage. And this was done for a 6-month-old baby who had some congenital anomalies. Was the ping pong ball necessary? You will not see the impact of the ping pong balls being placed inside the lung cavity after the lung is being removed, but it prevents the whole heart and the chest from shifting to the right side after the surgery after the child grows up. So this constitutes part of preventive healthcare in terms of surgery as well. Now, for those who do not know, this is a testis. The one which is red, bright red, is a testis that has twisted, and the one on the left, pink color, is a healthy testis. The question is, if a testis has twisted, and if the testis, after untwisting, it is still dead, should you remove the testis or should you leave it there? The answer is to remove it as well. Why do we remove testis that's already dead? Why not just leave it there? Because any testis that is left inside a person can ultimately become cancerous if it is already dead. It can become a cancer. So in this sense, we are actually preventing cancer by removal of a testis, which we suspect is dead. So as a surgeon, our question is always this: when in doubt, remove. Unlike in primary care, when in doubt, you leave it there. As a surgeon, when in doubt, we always remove, because things that we do not remove, things that which are being left behind, may ultimately end up becoming a cancer, becoming a problem to the patient. So what is preventive healthcare? Preventive healthcare is a branch of medicine that deals with management of diseases before they manifest, to reduce the burden of the disease or to delay the catastrophic effect of a disease. Now, this is the exact definition of preventive healthcare. Preventive healthcare, as we know it, only constitutes the first part. And what I've been discussing today constitutes the second and the third part of preventive healthcare. So now, let's ask ourselves a question. What is antibiotic? Is antibiotic a treatment? So understanding that concept, we now ask ourselves a question. What's the difference with treatment and prevention? Treatment is basically to try and solve a problem that has already arisen. Prevention prevents the problem from arising as much as we can, or even if it arises, you try to detect it as early as possible, or you try to reduce the impact of that. So antibiotic, we know we take antibiotics when we are sick, when we have an infection. So just a food for thought, which we will come back again towards the end of the presentation, is antibiotic a prevention or is it a treatment? Just ask yourself that question as we continue on and to see how much you have gathered from my presentation. So, as I mentioned, there were three parts to a definition of preventive healthcare. Primary prevention. Primary prevention is basically what we all hear about. It stops things before it happens. It lets us acknowledge and to understand the things that it actually helps us to stop something from happening altogether. Healthy living, change lifestyle modifications, exercise. These are ways we can actually prevent diseases. Healthy diets, a healthy, wholesome diet, simple products, facial washing, keep good hygiene, using good facial products, even brushing your teeth. All these are very important. All these are very important forms of preventive healthcare that you can do at home without any form of intervention, without anybody teaching you. And these are things that which have been taught to us from school, from young, from our friends, our family, our community. Then there's another part of preventive healthcare, which is basically interventional primary healthcare. One of the most important aspects of preventive healthcare is counseling. What do we mean by counseling? Counseling doesn't only mean talking to somebody who is mentally unwell, who is sick, who needs psychiatric help. Counseling means to help a person understand about himself, and counseling is a very key component of any form of preventive healthcare. The ability for a person to come and sit with a healthcare provider and to discuss about his health, to be able to go through potential problems and to prevent it from happening before it even happens. Vaccination, as we all know, all forms of vaccination are very, very important in preventing diseases. But let us first understand as well that not all prevention is 100%. Any form of vaccine gives you at best 70% prevention of the disease. But more importantly, it prevents you from getting a severe form of the disease or potentially dying from the disease. And more importantly, vaccination actually helps to give immunity to the community, not just to yourself, but everybody around you. Medication. There are some medications such as aspirin, which are actually a form of prevention. Elderly people are used to be prescribed aspirin, which was supposed to help to enhance your blood circulation and prevent stroke and heart diseases. And antibiotics. Antibiotics are being given before surgery. In some of the surgeries in patients who are infected, we used to give antibiotics before we start the surgery, or even patients who have completed the surgery, even without the source of infection. Antibiotics are given to them to prevent the infection from happening. Because as what you have seen earlier, when there is an implant which is being put inside, antibiotics can and will cause, can and will prevent infection, especially in patients who live in desolate places in conditions where their home environment is not great. Now, when we talk about primary prevention, what are the difficulties in getting people to buy into primary prevention? The problem is you do not see the effect of prevention because it prevents something from happening. So more often than not, when you tell somebody to eat healthy, to take vaccine, they will tell you, I don't see the effect. I don't feel anything. So this is where the question comes. In an alternate reality where vaccines did not exist, would half of the population have died because of a certain disease? Or if we did not know the effects of certain things such as tobacco, would everybody have gotten lung cancer from smoking? So when we educate people, when we talk to people about primary prevention or to prevent, to stop something from happening, the answer to education in this sense will always be the alternative, or what could have been, what would have been in the absence of these preventive measures which were being done. Now, let's be very clear about it. A lot of scientific research has gone into primary prevention. And up to today, quality of life in the world has improved because of primary prevention, because diseases have been prevented. Now, let's talk about something which is a bit more interesting to me. Secondary prevention. Secondary prevention is normally where the surgical side comes in, where things get a bit more interesting. There are two components of secondary prevention. One is the early detection, and secondly is for early intervention. What do we mean by early detection? Basically, if you look at all the pictures here, now this is a colonoscopy that we did. What is a colonoscopy? Basically, we put a camera from the bottom, from the anus into the large intestine, and we find for any tumors, any polyps, any ulcers. We take a biopsy in the hope that we are able to find cancers and treat it earlier. So this is a picture of a colonoscopy, and you can see there's a tumor which is sitting there. Yes, I did this colonoscopy if I'm not mistaken. So you can see the tumor that is sitting there. So early detection. The early detection only works well if there's an early cure. What else? This is a picture of a stomach. There's an ulcer there. This patient ultimately went and had his stomach removed, and he actually survived. This is a picture of an angiogram. If you can see the red arrows, that is blockages in the system, in the blood vessel. This is a stress test. Again, it shows again a form of early detection. A mammogram, if you can see the white spots at the top of the breast, that actually denotes what we call as macrocalcification. Macrocalcification means that there's increase in vasculature, likely to mean that there may be a tumor sitting there. Amniocentesis. Amniocentesis is a surgical procedure of which the fluid from the sac is being taken and sent for analysis to detect if there's any form of genetic disorders in a child. And sometimes these children may not actually make it to adulthood. And in many countries in the world, including Malaysia, not encouraging, but abortion of such a fetus may be necessary, in fact, to save the mother. Now, if you can see here, this is a picture of an angiogram of the leg, and there's a breakage in the white line. The white line represents blood. So where you see breakages in the white line, it means that there's blockages in there. So what are we trying to? So basically, the whole idea about preventive healthcare in early detection is this: you want to be able to detect diseases which are otherwise silent. Diseases that otherwise will not manifest itself unless you detect it. When it manifests itself, it may already be too late. So early detection and early intervention. Now, again, like what I've said, not every disease may have a benefit from early detection, but there are many, many diseases which benefit from early detection. And those are some of the examples I've shown you earlier. So what happens if you fail to detect things earlier? Remember this? This is a blockage in the arteries of the leg. And if you fail to sort that one out, we could have this. This is gangrene. This is death of the toes and gangrene. So what do we do when we find that there's a blockage? You intervene, you stent, or you do bypass. You can actually connect using vein grafts, vein implants to connect through the place which has lost blood supply. So all of this can actually prevent problems such as the one we're looking at, which is gangrene. Early intervention, bariatric surgery. Many people may not have heard the term of bariatric surgery or weight loss surgery. Weight loss surgery is not, in fact, a form of aesthetic surgery or cosmetic surgery. They're not done by plastic surgeons. They're not done by cosmetic surgeons. They're done by general surgeons and upper and stomach surgeons. Basically, we now know that obesity is one of the main causes of other metabolic diseases like diabetes, hypertension. And we used to say that there used to be no cure for diabetes and hypertension. But in the last 10 years, we have found that bariatric surgery, by removing in many different forms. Now you see the stomach on the right-hand side. That's not the whole stomach. There's just the largest part of the stomach that has been removed. The removal of the fundus or the top of the stomach has been shown to be a cure for diabetes and hypertension in patients who otherwise would not have been able to cure to rid themselves of insulin. Now, at this weight, any form of exercise is not going to be beneficial. So this is where a form of secondary prevention is bariatric surgery. And bariatric surgery has actually, in fact, saved countless of lives, people, and it improves mental health, it improves physical health, it improves the way they see themselves, their self-esteem, and it actually can prevent many, many diseases. So bariatric surgery is a very, very large component of secondary prevention surgical care. But sadly, until today, only a few states in the US do recognize bariatric surgery as a form of intervention. And insurance, even in Malaysia, bariatric surgery cannot be claimed via insurance. Of course, there are many surgeons who attempt to go around it in different ways, but until today, it's not been recognized as a form of treatment, and therefore it's not being covered by insurance. But many people, myself included, are fighting for it to be a part of mainstream preventive healthcare, because many people who are obese who have given up hope in themselves have found benefit of preventive surgery and have recovered and are now living very healthy lifestyles. This is a bypass surgery. You can see the heart, you can see the fat surrounding the heart. This is bypass surgery. Bypass surgery in patients who have not had a heart attack is a form of secondary prevention to prevent them from getting heart attack. If it is after a heart attack, it is both a treatment and prevention. It prevents a person from getting a second heart attack. At the same time, it can treat the heart attack that's already happened. Of course, the heart, the muscles of the heart which are dead is dead, but you actually give life back to the heart. This is an angiogram, and you can see the stenting. So this is through the heart into the heart vessels, and we put a stent there to open up the heart vessels. So this is a form of intervention for heart diseases. There you can see this is a form of early intervention. The polyp that we have seen in the small intestine. This is what we are doing is we are going in, putting a loop around it and snarling it using heat and burning to take it out. So this is very different compared to, so this is a polyp. A polyp may be cancerous, it may not be cancerous. But if a polyp is small and it has not spread, we always view cancer as a very, very bad thing. Of course, cancer means that there has been a defect in the growth of the tissue. But in many cases like this, there may just be a small foci of cancer, or for that matter, the whole thing may not be cancerous, and this patient did not actually have to go for full-fledged surgery. So early detection means that tumors such as this or polyps such as this may be successfully removed with minimal problems, without much damage to the whole gut itself. But what is more important in all forms of secondary prevention, again, is counseling. Counseling helps us to understand the options that a person have and the repercussions of the decisions that they make. And through counseling, we can prevent problems which may occur because, like her. I'm pretty sure that everybody would have heard about Angelina Jolie and her ideas of removing both her breasts because they found that she had breast cancer gene called BRCA1 and BRCA2. I will not comment about her choices, neither will I definitely agree with it, but everyone has made their choices, and that is why counseling on the repercussions of choices people make and whether they should make it, how they should make it, and when they should make it are very, very important in all forms of preventive healthcare. All right, from secondary prevention, let's go into tertiary prevention. Now, tertiary prevention is actually a slight misnomer. Tertiary prevention is a preventive measure that we take after somebody has already got injured, gotten the disease, been involved in an accident, already broken the leg, and so on and so forth. But why do we still call it a prevention? Because it is still a way where we try to assist a person in early recovery, reduction of the burden of the disease to the person, and ultimately we try to return them to as normal a lifestyle as possible. What are tertiary preventions? Physiotherapy, rehabilitation, prosthesis after a leg amputation, after surgery or after knee replacement surgery, bed sore prevention. You know, many people who have got stroke who are already bedridden, there's nothing much we can do about it. But a form of tertiary prevention is properly turning them around to properly provide them with their family, their carers, with wound management to prevent things like this. This is a very, very bad what do you call it? This is a very bad pressure sore from a patient who has been bedridden. Patients who are burn victims, you can see his is a scar. And over joints, rehabilitation and wound care is so important because without proper wound care, they may actually form scar tissues there and they will never be able to use their hands properly again. Knee replacement surgery is also a form of tertiary prevention for people who have got osteoarthritis of the knee, who've got rheumatoid arthritis of the knee. Knee replacement surgery is it's a form of tertiary prevention. Chemotherapy and radiotherapy is also another form of, it is a form of treatment, but there are situations of which chemotherapy and radiotherapy are forms of tertiary prevention as well in patients who have got cancer, who have had their cancers removed, although they may not require, but a form of chemotherapy is still being given to them to prevent, if any small areas of the cancer, so that we aim for full recovery of these patients. And most importantly, in any form of tertiary prevention, we have to educate and counseling again. Who do we counsel in tertiary prevention? We counsel the patients, the person themselves, on how they should care for themselves and how they should exercise and how they should improve themselves to improve their own quality of life. But there are certain groups of people who are debilitated, who are already not functioning very well, who are bedridden. The counseling has to be to the family, to the community, and the people around them. And family support in tertiary healthcare and tertiary preventive healthcare is very, very important. So once again, we see the importance of counseling and talking to people. So there you have it. Those are the three forms of healthcare: primary, secondary, and tertiary. And in all these forms of preventive healthcare, we now understand why we say prevention. In primary healthcare, you try to prevent a disease. From secondary prevention, you want to prevent the spread of the disease. You want to detect the disease early and sort it out as early as you can. And in tertiary preventive healthcare, you want to try to recover from the disease and to prevent any further complications of the disease. After going through the what's, let's now talk about why. So here's the very big question that I get very often and many people do ask. Why do we want to prevent something using intervention? I'm not talking about just your vitamins and your vaccination. Now when we understand preventive healthcare, we understand that preventive healthcare is more than meets the eye. It is more than just your vitamins, your vaccination, your screening. It is intervention. It is surgical procedures. So many people ask this question, why preventive healthcare? Why prevent when you can treat? And are you predicting the future that if we do not prevent, it will happen? So the answer to that is very simple. You must remember that we don't owe a duty of responsibility to just ourselves, but ourselves, our family, our loved ones, and our community as well. So when people ask this question, why prevent when you can treat? The answer is always, is it true that you can treat? Is it true that you're able to treat everything? Because there are many aspects of health of illness which you can treat, but there are many other aspects of illness that you cannot treat, such as the impact of a disease or illness to your loved ones, your family, your community that you live in, and the people who are close to you. In order for us to understand why we focus on prevention, let us look at our responsibility towards the community. Our first responsibility in the middle picture is to our family. Not only are the burdens of diseases higher, but prevention actually allows us to be able to spend more quality time with our family members, because it is better for them to see us healthy rather than for them to see us sick. And we owe them a responsibility in order for us to keep ourselves as healthy as possible for as long as possible. Secondly, in terms of infectious diseases, we owe a responsibility to the community that we are with. For example, look at the COVID-19 infection that's going on around us. One person who is irresponsible, a few people who refuse to vaccinate, can potentially cause the strain of the virus to change. And this change can ultimately be so severe that the vaccination which is being taken by everybody is unable to protect them from it. And that is why our responsibility to our family and the community is much larger than just the responsibility that we owe to ourselves. Intervention from prevention actually saves money in the long term. Just quote you an example. In 4 years ago, I met this girl who is 16 years old. She has a condition that we call inflammatory bowel disease, where there are small polyps in her bowels. We went in and we made the final decision that we are going to remove her large intestine, the whole large intestine, because there is a possibility of it becoming cancerous. Treatment, she has already spent thousands of dollars on treatment for the bowel inflammation. So we decided we will remove the whole thing. And because there is 50% risk, 50 to 60% risk of developing cancer. Now, when we talk about cancers in this group, it's not just a small cancer. It can be a large cancer. It can cause cancer which spread to the liver, to the lungs. And the cost to the family, the cost to her, and to the healthcare system itself would be much higher. So the decision was to remove it. And of course, now I think she's still alive. In Malaysia, we are very lucky that healthcare is more or less free, apart from several aspects, but most parts of healthcare is free. But we must remember that this will not go on forever, and this will ultimately end, because the burden of healthcare in Malaysia is ever increasing, because the government healthcare system always focuses on solving a problem, because in the short term, it is viewed that solving a problem or treatment is cheaper than prevention. And prevention cannot be measured, because how much savings can you accrue if you do not know in an alternate reality whether something will happen or not? So this is a responsibility to our community. Quality of life. Quality of life is not just our own quality of life. It is a quality of life of us, our loved ones, and those and our family members. When we talk about quality of life, let us first focus on the cancer patient. Quality of life is not just about the inability of somebody to not be able to do the things they want, but it's also the struggle, the mental agony, knowing for a fact that an end in sight. This is bleeding from the stomach, from a patient who has got liver disease. This is a young child who had severe infection. You can see all of the cellulitic injuries around the body, which looks like burn wounds, but those were actually cellulitic injuries on the side of the body. It's a young child with severe skin infection. This is a patient who actually had diabetes, uncontrolled diabetes, and that you see is a scar from a carbuncle. We removed that whole area which was infected and had an abscess, was oozing with pus. And this was a picture taken about 2 months after we had removed it. The process is called saucerization, where we removed the whole thing. This was my patient. Depression. Mental health is one area that is so difficult for us to put our finger on. Many people equate depression with sadness, which is not. And we are not just talking about depression for the patient itself, which affects the quality of life. We are talking about the effect of depression and mental health on the rest of the family as well. So what is important in here is support, family support, community support, and through this we try to prevent problems that can debilitate the quality of life of individuals, of people, so that we know that death is inevitable, but we always hope to have a good ending rather than suffering, or worse still, suffering that is prolonged. Not just physical suffering, but emotional suffering as well. And not just yourself, but those around you. Time. I think time is the most important factor. We do not know how, when we will die. The only truth is that we will die. But before we die, before we focus on death, I think the important part is to be able to live a life which we are able to fulfill the things which we want, which we are able to contribute back to society, that we are able to achieve our dreams. And in order for us to do that, we need to ensure that we have a healthy mind, a healthy body, and a healthy soul. And we owe this to everybody that we know, our family, our friends, our colleagues, in order for us to focus on life before our time is up. And that is the key essence of preventive healthcare. In order for us to focus on life, its benefits and its beauties before we call it a day. So with that, I just like to share the 3 E's that I have been using. I think preventive healthcare is one thing that we are all responsible to spread to the community and to spread to everybody. And that is why, although as a surgeon, I've seen a lot of cases, we have managed a lot of tragedies. But the 3 E's are very important if we are going to want to spread this ideology, to spread the idea of prevention to people we know. And when we talk about teaching people, education means educating ourselves, educating those around us, educating community, and to keep ourselves well educated. Empowerment, of course, and in my time when I was in the surgical department, my form of empowerment has always been to guide and to teach the younger people and to empower them to make choices. As we are here today as an advisor to Vaccine Plus, I like to, my form of empowerment are for the people who are working in Vaccine Plus, the community educators, to empower them with the ability to be able to empower other people and to educate other people on the importance of prevention and to lead by example. There is no point and there's no use in joining a program or be part of a program to say that we're promoting preventive healthcare if we ourselves are not practicing what we preach. And that's why we should always lead by example. For the record, yes, I am vaccinated against COVID-19, and I hope you are too, or will at some point of time. With that, ladies and gentlemen, I thank you very much. And I hand the floor back to Evan.
Okay, thank you, Dr. Alwin. Now, we are going to open the floor for questions for the next 15 minutes. So if you have a question, please. Okay, so I think we have a question from Mr. Alex. Please unmute yourself. Okay, anyone else? Any questions? Yeah, Purna, go ahead.
Hi, good evening, Dr. Alwin.
Evening.
Hi, I'm Purna, and I think I have got 2 questions for you.
Yep.
And thank you very much for the presentation. It was very enlightening, very informative. So my first question is actually about the company, VaxiPlus. What would you constitute as the strength of the company? That would be my first question. And my second question, if the company has had any liaison with government sectors, mainly the health ministry?
Okay. I will not answer questions pertaining to the VaxiPlus program because number one, I am not a member of VaxiPlus, and as a medical advisor, I stay out of the corporate structure of VaxiPlus altogether. So I will leave that question to be answered later on by Jeevan. But yes, as a new company, one of the frameworks that we have is actually to connect the program with the Ministry of Health's preventive healthcare initiatives as well. Now, when we sat down and I advised them on how to develop the framework, what we felt lacking in the whole framework of healthcare in Malaysia is that it was a point of contact care. What do we mean by point of contact care? It means that everything is opportunistic. If you do not fall sick, you do not go to the hospital. If you do not go to a hospital, you have almost zero contact with any healthcare personnel. The outreach programs which are being held are very, very much limited. So one of the ways that we figured would be best to address this was via the VaxiPlus program, where we empower people. Again, I like to use the word empowerment. We empower people to become community educators and to educate people around them. You start with your family, you go to your friends, and you go to your community at large around you. But what can we do to incentivize people in order to do it? Otherwise, as much as I am passionate about this, I cannot expect half the world to be as passionate as I am. So that is where the network marketing element came in, and the network marketing element was, of course, the brainchild of Jeevan and Naveen. So I will leave that element to them. But yes, as although we are just starting out, we have got several engagements that we have had with several personnel from Ministry of Health, and we are looking into joining with them. But because of the conditions of COVID-19 and the MCO, I think our focus at this meantime actually is to gather as many community educators as we can into the program and to guide them to understand what this is all about, and not just the incentive part of it. And that's where I come in, the healthcare and medical part of it. Of course, your first part of your question, I'll leave it to Jeevan after this.
Doctor, thank you.
Thank you, Purna. Thank you, Alvin. Anyone else? Any questions pertaining to preventive healthcare? Yeah, Ms. Juzita, is it?
Yes, I'm Jazita. Can you hear me?
Hi, yes, I can hear you.
Yeah, okay. All right, Doctor, good evening.
Good evening.
And this is very good programs. I will believe that it should be shared to others also. Okay, definitely to share who actually can participate. I would like to know who can participate and how actually they can participate. You know that in Malaysia, sometimes who already have that disease like diabetes whatsoever, if they take the insurance, they cannot go, they cannot get they cannot covered by the insurance or to that package. So how does this program works for the society? All right, I think that's all.
Okay, thank you, Manjusita. I think one of the important things I've learned in my 10 years as in the government hospital is the people who need care the most are not getting care at the right time at the right place. And this is exactly the same thing about insurance policies. I'm sure there are a lot of people among you who are into insurance, but people who require care, such as people who already have got diabetes, who already have got the disease, are unable to sign up for insurance programs. And that is why the VaxiPlus program, when I counseled for them, I said, it must focus on this group of people. It must be able to give them a way for them to, yes, correct, you earn, you make your money, you keep your money. But on top of that, we want you to be able to do a good thing. That's the most important thing. That is to spread the word of preventive healthcare. Number two, to earn yourself the ability and the probability to gain yourself treatment. So now, we start as a startup at the conception of it. You want to focus on the first two aspects of prevention, to prevent something from happening, and for early detection so that we can intervene. But of course, once the member base increases, once we have people who needs it, there's no discrimination. If a person has got cancer, a person has got high blood pressure, has got diabetes, nothing is stopping them from joining the program, because these are the people who needs regular screening. These are people who will benefit from regular blood pressure screening, who will benefit from all forms of intervention. I am in negotiation with several hospitals for them to hop on the program to be able to provide intervention, the few types of surgical intervention. And as of now, there are already 2 hospitals which we will name after this round of MCO is done, who will be hopping on into interventions. And that is why I spoke about intervention, because intervention for this group of people who are already unwell is so important. And this is one part which not even, let's forget about insurance. Malaysian government is not even covering. Hope I answered your question.
Thank you. Anyone else? Any questions? Yes, Om Shri.
Hi, Dr. Alwin.
Hi. Hi.
Can you guys hear me?
Yep.
Okay, so I just wanted to ask, okay, right now when I've done the screening and I found out that I'm okay, right? I don't have anything major. So that's step 1. So what's the next step? Like you take bigger and like the mammograms, the whatever and stuff, and everything is clear. So how often do I need to do it? Like my family has a history of cancer, diabetes, heart, you know, we come with the whole full package. So what do you recommend? Like, since they, oh, I'm fine now, there's nothing wrong with me, I just did my check, you know, I don't need this. What do you say to people who say things like that? Thank you.
Omshri, okay, thanks Omshri for the question. I think one of the most important aspect to address here is the misnomer that if you are fine today, you'll be fine tomorrow. Every form of disease has its natural progression. Let's talk about breast cancer, because breast cancer, I think I see a lot of ladies in the crowd, and breast cancer is one of the areas that I used to be quite passionate about. We used to do breast cancer and the reconstruction after breast cancer as well, after breast cancer surgery as well. Why is it that it was an area of importance to be addressed? And I will answer your question through this. Is because breast cancer can be a very, very small dot, a dot which is so small we can remove by what we call as lumpectomy, by just removing a quarter of the breast. And we take 2 lymph nodes and test. And it can be so severe that it stings, literally. It's got pus, it's got fungation, it's got blood squirting out, it's black, it's green, it's yellow, it's got the colors of the rainbow on it. And we've seen it all. And very often, more often than not, breast cancer, the person who actually prevents all of this from happening is the husband, prevention, from early intervention. So to answer your question, it takes 3 to 5 years for a breast cancer to develop. So if you detect, if you do a mammogram today, and then most of the time it's mammogram plus an ultrasound, and you come back negative, you're absolutely fine. Does it mean that you'll be fine for the rest of your life? No. The least aggressive strains will take about 10 years, and the more aggressive strains can take 3 years before they can be detected. So 1 year down the line, if you start developing breast cancer, and you do not detect, that's that's also the main reason why for ladies, one of the most important secondary prevention is actually breast self-examination. And how often do we tell you to examine your own breast? We don't tell you to examine once a year, once every 2 years. We ask you to examine every single month. Because a tumor which may not have been picked up on a mammogram this year may start to manifest itself 6 months down the line, and which may then require you to go for a mammogram. So then again, everybody tends to be slightly different. So if you have a positive family history, then your mammogram has to be every year. Breast examination at least once a month. Now, if we are talking about things such as colon cancer, it takes about 10 years to evolve. It's called adenocarcinoma cycle. It takes about 10 years for it to develop. So that's why in many patients, what we do is we do a scope, and if it's clear, we tell them to repeat a scope again in 10 years. But what do you mean by clear? What do you mean by clear? Clear doesn't mean that you don't see a tumor. Clear means that you do not see a polyp or any indentation or any weird markings whatsoever. How many people do we come across and we say they have the absolutely clear colonoscopy? I've seen about 30–40%. Everybody will have something. You've got small polyp, you will see a small chunk of meat there, which then, based on that interpretation, the doctor, the surgeon then comes back and tells you, you need to repeat this after 1 year, or after 2 years, or after 3 years. Then we look at the results again from the lab, and we send it to the lab. So your answer to, if everything is clear today, what do I need to do next? You need to repeat. When do you need to repeat will depend on what you find. Your blood test, it depends on your age, it depends on your family history. Do you need to repeat it every 6 months? Do you need to repeat a blood test once a year? Do you need to repeat a blood test once every 2 years? Now, if you are 20s, you should do a blood test maybe once every 2–3 years, full blood test. But if you are above the age of 30–40, you already know you've got high blood pressure. You already have got some amount of diabetes or cholesterol. Then you may want to repeat every year. So again, it differs from person to person. But the answer to your question is this: if you are normal today, you need to repeat this, not until something abnormal comes up, but to ensure that you are continuously normal. Hope that answered your question.
Yes, thank you.
Okay, final question. One final question. Anyone else? If not, we would like to continue with the second presenter for today. Okay, just one moment. Now, on the second, we will move on to the second topic for today. And the presenter will be Mr. Jivan Kopasamy, the Executive Director of Magnitude Healthcare Consultancy Center, Berhad. And over to you, Mr. Jivan.
Thank you, Liban. Thank you, Dr. Alwin Lum. Thank you, everyone, for patiently being here and listening to what Dr. Alwin Lum had to say. Now, let's see some reactions. How many of you have had your dinner? Please raise your hand. How many of you have had your dinner? All right. How many of you were feeling squeamish or funny when you saw the images that was shared by Dr. Alwin? Did you feel bad looking at those pictures? Did you feel disgusted looking at the pictures? Or did you feel, yeah, it's fine, I've seen this many times? You see, more often than not, we are not happy at looking at these images. But at the same time, we feel indifferent mainly because it has not happened to us. Okay, we are not really in participative of what is happening and what has been shown. So this is something that we had in mind, and we decided that we have to do something about it. So that's when, all right, when Vaccine Plus was initially started. One second now. Okay, I'm going to share my screen. Can you all see my screen right now? Okay. All right. So why did we want to bring such a, such an important topic, such an important issue into network marketing? What is the whole point? There must be something not right with these guys. Why are they bringing preventive healthcare into a network marketing module? Now, in order for us to answer this, what we need to do is we need to look into the secondary question. Okay, what is network marketing? So, to answer your question, all right, what is network marketing, or another common term that is used is direct selling? You see, network marketing is a dynamic, rapidly expanding channel of distribution for the marketing of products or services directly to consumers. Okay, it is a branch, it's an industry that is monitored by the World Federation of Direct Selling Associations. There are currently more than 60 national direct selling associations represented in its membership. Simply put, it is assisting the increase of sales of a product or services of a company, okay, through word of mouth and getting paid for it. Now, this is something that we have been doing throughout our life, but we have never got paid for it. Now, simple fact, when you have watched, Avengers Endgame, all right, we actually go and talk about it. We talk about it in our social media. We talk about it to our family members. We talk about it to our friends. We talk how wonderful the graphics was, how exciting it was. We actually indirectly promote the movie to our friends and family. Now, when we do that, what happens is the production company, which is Disney or Marvel, is making money. The theaters are making money, right? The actors are being paid better for the next movies. But what we have done is we have paid for the ticket. We have gone to the theaters. We have bought the popcorns, we ate it, and we contributed to the movie making industry, but we did not get anything out of it. Now, this we have been doing it throughout our life. When we go to a particular restaurant, the food is good, we recommend it to our friends, right? When we see a good doctor and everything, we recommend it to our friends. Now, let's look into the evolution of network marketing. What is it all about? See, phase one was the agricultural age. Okay, for simple calculation purposes, let's look into before 1800s. Now, when a particular group of humans go to a particular area and they realize that the land in that area is good for cultivation, it is good for planting, it's good to grow fruits and vegetables and all, they actually harvest it and come and sell it in the market. So when their product is good, they will ask, where did you get it from? Where did you grow it? And thus they say that this is the land I've been cultivating. So more and more people go there and start cultivating. Okay. At the same time, when they go to the market, they say this vegetable vendor's produce is fantastic. So more and more people will go. It's through word of mouth. There was no WhatsApp, there was no Facebook, there was no even printing papers and all, so and so forth. Okay, so it was purely through the word of mouth, through their own network. Now, if you look into the phase two, the industrial age, for easy reference, we take it until 1970s. Okay, we had mom and pop stores. We had, little little shops where mother and father used to run a family-run business. They've been doing really good. They used to bring in their own home-based products, sweets, cakes to be sold there. Then what happened was they added more items to it. It became departmental stores. Then what they did was they made it bigger, from just a grocery stop, then from an apothecary or a pharmacy. Then they went into hardware. It became supermarkets or hypermarkets. Then when one area really becomes good, people start going there to cater for more people. They open franchises. Okay, a simple example of franchise is 7-Eleven. Okay, everybody knows 7-Eleven used to be open 24/7. Of course, at this time we have restricted time, but 7-Eleven became famous and they are all over the world. Okay, so this is because of networking. Now let's look into the information age, which is phase 3, into after 1980s. Telemarketing started coming in, TV shopping. Now people are coming and selling stuff inside your house. You don't even have to open the door and admit them in. Now they're coming into your TV. This is directly when you're subscribed to the network and you have the TV in front of you, you are a network of them. Then, of course, we had direct selling. We had companies like Avon, companies like Amway, so many companies, that had people were going from house to house, and then they become a member so they can buy stuff for cheap, and then they go and sell to their friends and family, and of course, e-commerce. Now, you see, all this is actually essentially network marketing. I have something good with me, and I want to share it. Now, when I share it to my network, my group of people. Okay, so when we looked into the benefits of network marketing, right? We look into the benefits of network marketing, why VaxiPlus has come into the network marketing segment. Network marketing is a good way to meet and socialize with people. VaxiPlus is a good program. It is good to be shared. You share it with your own social circle. Okay, network marketing offers flexible working schedules. You should be able to promote VaxiPlus at your own free time. Okay, network marketing is a good way to earn income. You can earn good income in VaxiPlus if you do it right. Network marketing is a good way to own a business. This is when we call our members community educators. So when you become a community educator, what you're essentially doing is you are training more community educators. You are a business of your own. You are a leader of your community of your own. There are no required levels of education, experience, financial resources, or physical conditions. Anyone can do it. So if you're going to talk about good health, you don't have to be a doctor or a surgeon like Dr. Alwin. We know that being in good, healthy condition is important. So what we do, we actually emphasize that to our family members. Of course, I don't want you to be going and saying that the way to do an endoscopy or a colonoscopy, but of course, when you have something good with you, you want your family to be healthy, you don't have to be a doctor to go and explain this. In fact, our family members, our generations have had this sort of remedies, this sort of do's and don'ts on how to be healthy. And we have been doing it. People of all ages and backgrounds have succeeded in network marketing. So like we say just now, you don't have to be a doctor to talk about good health. You don't have to be a businessman to do business. Anybody can do it. And network marketing module has proven time after time that it can be done. So we are coming back to the next point. You are your own boss. The idea of you are your own boss, which means that you can work part-time or full-time. You can choose when and how much you want to work. You can set your own goals and determine yourself how to reach. You can earn in proportion to your own efforts. Someone's not muted.
Yes, sir.
Yes, okay. All right. So ladies and gentlemen, kindly please mute yourself because I'm trying to explain something that I feel very passionate about. So when you come in, it's actually disrupting the flow and disturbing the others. Okay, so coming back to earning in proportion to your own efforts. The level of success you can achieve is limited by your own willingness to work. There's a lot of time that we always gripe. I'm going to work, I'm doing so much of work, I'm doing the work of 10 to 15 fellows, but my salary is still the same. Okay, this is traditional mindset, traditional job just over broke, a traditional job. So we wanted to have VaxiPlus as something that a person can do on their own, promote the willingness, on their own willingness, promote the benefits of preventive healthcare at their own time, at their own level. And of course, in network marketing, one of the core benefits, which I always feel very passionate about, is you will have an entrepreneur mindset. Personal development is inevitable. I'm pretty sure most of you would have been mind blown with Dr. Alwin's presentation on how much of sector is covered in preventive healthcare by surgery alone. Of course, Dr. Alwin spoke about other stuff as well, but this is a very, very unique thing. Now, this is an information that you would take away today without any expectation from you, all right? And of course, through this kind of network marketing, you can receive training and support from an established company. We're talking about an established company. Who's the company? Magnitude Healthcare Consultancy Syndrome, which is part of Magnitude Group of companies. Under Magnitude Group of companies, we have MH Clinics, we have Alpha Biomedical Solutions, we have Magnitude Healthcare Consultancy, and more. There's a lot. And the amount of, businesses and projects that is being handled by Magnitude Group of companies is just out of this world. And they have decided one of the best way to bring this, mindset of creating community educators is through network marketing. You can see for yourself on your screen. Now, I'm pretty sure whenever we talk about network marketing, what people say, it's a scam. This one is only for housewives, lah. The wives are sitting in the house, they're taking care of the family and all these things. Some of them say it's a sponsor scheme. Some of them say it's a side business. Why do you have to do it so much? Someone will say, it'll only give you some additional income, bro. Now it'll give you some little bit on how much you're going to earn. The other naysayers will say, it'll fold up soon. You have been duped. Mark my words, you will lose money. And the worst part is, who are the people who says this? It can be our family. It can be our neighbors, our friends, failures. Who are the failures? People who have gone and joined a business or a scheme that required them to bring out 20,000, 30,000 ringgit, stock up product in their house, be a stockist, unable to sell it. They lost their money. They had to take loan from somewhere and buy these products and do it. They were unable to pay. These are the failures. Colleagues, our own colleagues in the offices. And of course, the crowd. Okay, so who should you listen to? When you need advice on a specialized subject, like when you fall sick, who do you seek and take advice from? For instance, Dr. Alwin spoke just now about preventive healthcare from a surgical perspective. Dr. Alwin spoke about a lot of things. He has the credentials. He's an expert in his field who has been around for some time. Or would you rather listen to the ane on the street? Will you listen to the novices or the experts? Of course, we want the expert opinion. We want the expert feedback. We want to know what is it all about. So VaxiPlus is a program. You're having the experts of the healthcare industry. You're having the experts of the multi-level marketing or the network marketing industry coming together on a general platform. We are not selling you miracle products. We are not saying that this tablet was done research. It was found in the Amazon's jungles, climbing the Mount Kilimanjaro, going into the deep in jungle. We found this root. It has been researched by the Swedish professor or a Japanese professor who died 40 years ago. And finally, we found the secret and the miracle. No, we're talking about your doctors from your area, from doctors from the clinic that you regularly go. The doctor who has been treating you, looking at you from day to day, from the day you were born. Those are the experts. These are the people who are going to talk about preventive healthcare and do what you need to do. So you rather listen to them. I want to tell you a very simple story. This is a very personal story for me. All right? It's a very personal story for me. And this is the first time I'm sharing it in Vaccine Plus group. About 14 days ago, I lost a family member. Due to COVID-19. Okay. Now you see, the family member knows what we do, what is our background. Okay. The kids had COVID, right? The father was a single father, was taking care of the kids, but he gave all the attention to the kids. He did not give attention to himself. But however, we told him he needs to get himself tested. We need to go. We need to do what we need to be done for him. But he said, I'm fine. I don't have any issues with it. Right? He said, I'm drinking this particular potion, which I'm boiling in my house, and that is curing me. I went and got myself tested. It is not appearing in the COVID-19 testing. Where did you get this remedy? When we asked, he said his friend sent him through WhatsApp. And he was drinking it day after day, day after day. He contracted COVID. 5th day, he's no longer around. He was brought in dead to the hospital. We could not even see him. We cannot do anything. He's my father's own brother. So he listened to the advice that he received through WhatsApp on a particular portion, but he did not think of seeking an advice from an expert. So this is something that I want all of you to really, really look into this. Why are we talking about this? Okay. Now, let's look into this. Network marketing, investment, people say you have to invest a lot of money. Let's look into two different angles. Let's look into franchising. Let's look into network marketing. Franchising, when you want to start a business, let's say Vaccine Plus, we decided to start it as a standalone office or an outlet. The seed capital is very, very high. For network marketing, there's hardly any seed capital. Working capital is very high because to operate an outlet, you need to have people managing the outlet, doing everything. It's very high. In network marketing, it's almost negligible because it is you who are going and doing it at your free time, at the way that you want to do it. The risk is also very high. Now with the lockdown, with the MCO, you can't live more than 10 kilometers of your place. You have to seek treatment within your own areas. You know, cannot open. Today, Meety says can do. Tomorrow, Meety says cannot do. We have so many people giving us all sorts of information. Whether the shop we open will run or not, nobody knows. So many. The first MCO, you can see yellow banners hanging everywhere, almost every little town. To sale, for rent, to sale, for rent. Business closed down due to MCO. But under network marketing, it's negligible. One good thing about franchising is you have control. You want to open the shop today, you open it. You want to close it down today, you close it down. The control of the thing is there. In network marketing, the control is very low. Why is it low? It's because when you have the community educators who are going in, talking about it, they have to move. If they don't move, the network will not grow. So here, the only aspect to guard against this, the low item in control, is self-discipline. And of course, when you get the right remuneration, everybody will be very disciplined. So this was one of the things that Vaccine Plus looked into this. Now, usually when you want to join a company which is propagating about network marketing, you have to look into 4 parameters. What are the parameters? Number 1, product or service. What is the product and what is the service? Can I talk about the product? Am I expert enough to talk about the product, or do I know enough about the product, or do I know enough about the services? Now I know health is good. I know doctors are doing good job. I know that screening is important, vaccination is important. So the service is good. Next thing that we need to look into is a compensation plan. This little area here, compensation plan. If I do this much of effort, what do I get? How is the compensation plan? Is there any way that I can be cheated? Is there any way that I have to put 100% of effort to get 10% of a result? Then you have to look into the learning plan. This portion, what do I learn from this company? If I'm going to sell soap, how much can I learn about soap? How much can I learn? How many types of brands of soaps are there? And am I convincing enough to be a soap seller? I'm just talking about very simple soap. Maybe facial creams, fairness creams, this and that. Am I convincing enough? So you must look into this as well. What is the learning? What is the takeaway at the end of the day? And of course, last but not least, mentorship. You need to have mentors who's actually going to tell you, what is it that you're doing? What are you doing here? Why are you here? And what is the takeaway? You need to have a good mentor. So that is one of the key criteria for VaxiPlus. We want to create community educators who will in turn become mentors for other community educators. And you're talking within the framework, within the technological advance and what is available in the healthcare industry. You're not going to talk about something that is not available. This is what is available. You're talking about proven methods. So this makes it a good idea to bring VaxiPlus into the network marketing aspect. Okay, so with all these things in, VaxiPlus is now under the network marketing element. So what do you, a person who wants to come into VaxiPlus, need to do in order to be successful? Now this is actually generally, this is not just for VaxiPlus, please, ladies and gentlemen, please understand this. This is generally when you are getting into network marketing. First of all, you need to brush up on the realities of multi-level marketing. What is it all about? You cannot make decision based on what you have heard people telling you or what you have received in a WhatsApp. You have to be able to understand the realities of network marketing. I will come back to that. I will tell you the realities of network marketing. Where is it right now and where is it expected to be? You have to be able to find a company with a product that you love. So if you are a person who's into beauty and all these things, of course, look into a company like Avon or something like that, or under MBA Artistry or something like that. If you're looking into, alternative medicine, then you go and get this sheep's placenta for this collagen, this and that. But this is a product that everybody, whether you like it or not, it's necessity. Preventive health, general well-being is necessity. And for you to be lovable to others, you need to be healthy. You need to be genuine and ethical. The reason that we are getting people like Dr. Alwin to come and talk is because you are listening from the experts. So if you are unable to get the information to others, you can always invite them to sessions like this, where genuine information is given to you. And once you have received this information, you can share this information with others. And you have to be ethical about it. And there's no way you can be wrong. You're talking about vaccination, you're talking about screenings. This is important for each and every person. Don't go and harass your friends and family. You can tell them, I'm having this. I've got my screening. I've gone for my 10-point screening. I know what is wrong with me or what is right with me. I think you should do. Yes, fantastic. No, thank you very much. But you must always understand a future reference is always there. So I will remember the first rejection is always friends and family. So remember, bear it in mind. Of course, now you don't have to look into your family and friends alone. Most of us are well connected on social media. We all have at least 1,000 to 2,000 friends. We can always look into that. You can create pages. There are so many ways. Some of us look into TikTok. Some of them look into Instagram. Some of them, I'm so surprised. I saw a guy in a Pakistani restaurant about 4 months ago. I think, Liban, you were also there. 4 months ago, two fellows were sitting down, and when another friend of mine said, "You see those two guys?" Yes. They are each having about 500,000 followers on Instagram. They're just sitting there in the restaurant and they're still networking. That's a very good way. You have to be able to make an effort to share the idea of what is Vaxi Plus almost every day. It is an effort that anybody needs. Like I say, you set how much you're going to earn. Sponsor, don't recruit. What is the meaning? Of course, there's no sponsor here. You are getting community educators, but don't just recruit them. You must be able to look, why are they not moving or why are they moving? So this is something training. You have to impart the knowledges and all. So being a community educator does this for you. You have to be setting a goal for parties or presentation. Parties in the sense that when you're able to have it in your house once the MCO is done, or you can have online presentations of this. If you're not having a Zoom account, or if you do have a Zoom account, but you don't have a paid account, always contact through the Vaxi Plus leader who brought you into here, or you just inform your leader and the company will arrange for you a session. So you can have once a week your own session to inform people. You don't have to present it. You can introduce and let the presenters, the experts, come and do the work for you. You have to be able to listen to sell the solution. You have to be able to understand. Listening is one. You have to be able to understand to sell the solution. You have to be able to learn how to market. Now, sessions of this kind will be done at least once a week. All right. And of course, you have to be able to stand out from the other distributors. Now, these are the benefits of, the do's, what you need to do in order to have a successful network marketing businesses. Okay. Ladies and gentlemen, it is time for all of us to wake up and see the reality. You can see the texture. While we gleefully accept others as industry or genuine businesses, but label network marketing as housewives or husband's spare time business. Let me tell you something. From network marketing, there's another branch called affiliate marketing. Okay. For instance, Facebook. Facebook, you can pay to advertise. So when you pay to Facebook, Facebook advertises your ad to the network of people under them. If a company like Facebook can understand the power of network marketing, right, which we always use, there should be something about it. Those housewives and husbands right now must be laughing their way to the bank. Most of us are open-minded to find a job that we hate and get into debts. There's an idea, my dream is to earn enough money so that I can buy a car in loan and then use that car to go to my job. We are so close-minded to look into a solution. Now, how is that working out for them? Or some of them have lost their job for almost a year sitting in the house. Some of them have gone into becoming a Grab driver or a food panda delivery guy. There are hundreds of deaths so far. All these delivery guys are being, run over by car, crashing into this and that. I feel sorry for them, but this is something that people have to do out of their necessity. So look into that. Look into the reality. All right. Step by step, the journey to success begins with the right business attitude. Clarity about your goals, a must. Be genuine, it works better then. Understand your target market well. Get your channel right. Befriend social media. Social media is there. We are all in social media. You have to be able to embrace rejection. Not everybody will say yes, and not everybody will say no. The business is meant to serve people. Vaxi Plus is meant to serve people. And in order to do that, we should never stop learning what is being said and what is being done. Using the right tools, you have to find a guiding light. Who's the guiding light? It's the person who brought you here. That person has information that you need to have today. People like Dr. Alvin, who's having the information. Of course, I'm not asking you to go and harass him right now, but what you need to do is take away, see what is the entire thing. Now you have listened to the information, you should be able to formulate and bring it to the rest. And believe in the team, believe in your community, believe in the people who have brought you here. All said, I'm not asking you to leave your full-time job, don't. Majority of the people who have found success in network marketing, okay, has always been a part-time. Yes, this is an added income. The day network marketing's earning supersedes or goes higher than your monthly income, then you make a decision. In order to get there, consistency is the most important thing. It is the key to everything. Consistently, you have to be doing what you're doing. You have to hang in there. Success does not come overnight. It does not come just like that. Vaccine Plus, we have been planning it for some time. By the time we're actually able to roll out, due to various reasons, we are here. Vaccine Plus is here. So hang in there. Right? Now, let's look into, I said, how big is network marketing and where is it going to be? Network marketing or direct selling is one of the oldest business models. Network marketing companies are operating successfully in over 100 companies. Promoting through network marketing activities is more profitable. In 2019, the global network marketing industry was valued at 167 billion ringgit. By end of 2020, the global network marketing industry has touched 200 billion mark. Okay, China, US, and South Korea are one of the top markets for network marketing. China, of course, they have the people. US, because they have the American dream. South Korea, right, is because of the acceptance in their culture. This is another important element. 4 out of 5 MLM businesses or network marketing businesses are growing rapidly. Foreign direct investment policies are offering retaining environment for network marketing. Ladies and gentlemen, we are in 2021 right now. By 2025, the global network marketing industry is likely to be worth nearly 650 billion US dollars. Okay, that was, yeah, all right. So final thoughts, ladies and gentlemen. Remember, network marketing and direct selling are synonymous. Yet people look at the former with a lot of distrust, purely out of ignorance. They do not know what is it all about, all right? We have identified that, and that is the reason the Vaccine Plus platform is here to you under network marketing. So with that, wish you all the best, and I'm ready to take the questions. Thank you.
Okay, if anyone has any questions, please unmute yourself and you can relay the question to Mr. Jeevan.
Before that, let me just answer the question that Purna had. Can you please repeat the question if you don't mind?
Hi, Jeevan, I asked if what would you constitute as the strength of the company? And then the second question was if the company has had any liaison with the government sector, mainly with the health ministry. So I wanted to know if the company had done any projects with them in the past.
Okay. Now, the first question is, what are the strengths of Vaccine Plus, correct? Kavita?
Yeah.
Okay,
Sorry, Mike.
no worries. Okay. See, what is the core strength of VaxiPlus? Now, you see, the core strength of VaxiPlus is we are not asking you to go to one particular clinic or one particular center. You can actually go to the regular clinic that you have been going, where your family members have been going. So when that happens, they're actually going and seeing their personal doctors or physicians or whatever it is. Now, this means that the company is not trying to make money by driving the force to them. What is happening here is we are asking you to explain about the benefits of preventive healthcare. So by doing so, the company's main idea is to create a perpetually healthy community. Now, you see, we strongly believe that each and every person has the right to access proper healthcare. The issue right now is majority of us step into a hospital because we have to. Nobody steps into the hospitals or clinic because we want to. Now, the idea is to get people to go on their own so that you can foresee what is going to happen to you. So one of the key elements here, the takeaway is, okay, we can achieve this, all right, in a manner of without, selling a product or something. We are just introducing the idea of preventive healthcare. So by not diverting them to our clinics, by getting them to go to whichever the clinic that's available, is actually getting them more clarity and more comfort over there. Number one. Now, number two question is whether we have had any liaison with Ministry of Health Malaysia, correct? Okay.
Yes, that's correct.
Now, let's look into VaxiPlus. VaxiPlus is a program. Okay, it's a program. Now, this is a program that we have been advocating for a very, very long time with Ministry of Health, with various departments and all. Now, they are service providers. They are the gatekeepers for medical side. They are the service providers. They cannot be seen as a person who's promoting this. We have had so many programs that have been brought by Ministry of Health. We have the coverage, which is the My Salam. You go to any clinic Kesihatan Malaysia right now, or any hospitals, there will be pamphlets and posters that tells people about all these things. They have had so many programs that have been coming out of Ministry of Health, but the implementation, okay, even though it was done, but the reception from the people was never there. It's because they can only talk about it, they can say, but they cannot force someone to do it. So what happens is the VaxiPlus program is getting people to come in on their own accord. By coming in, there's a compensation. So this will be an excellent program that is running parallel with the vision and mission of Ministry of Health, number one. Now, number two, a liaison with Ministry of Health or KKM. Now, you see, the people who are in Magnitude Healthcare Consultancy, they themselves are people who have done various projects with Ministry of Health. Okay, for instance, Dr. Alwin was the chief registrar. Okay, he's a surgeon who has served in the government sector. Now, me, myself, my main stepping stone into the medical industry or the healthcare industry is because my core work is actually I design and build clinics and hospitals. So I have renovated more than 2,000 plus hospitals for Ministry of Health. In fact, we have liaised with every single department, whether it's section operasi biomedical, whether it's pharmaceutical, whether it is dentistry, a lot of them. So when we liaise with them, at the risk of being quoted, I'm going to say this. People who are in the administration, they themselves know that some of the projects or the programs that is being brought in is not reaching the general public. It is not reaching the general public. So they actually are looking forward to this sort of elements as well. Now, here we are not going against the line that has been set by the Ministry of Health. We are not claiming to be experts in preventive healthcare. We are not claiming to cure anybody's sickness. We are not claiming to say that we have a product, take this, everything will be good. What we are advocating is this preventive healthcare is an important aspect. Now, under preventive healthcare, there are so many elements that is important for each and every one of us, and get to know it and get more people to know it. When you come into a subscription program, what happens is by getting more people to know it and to enter into the program, you generate an income. Now, this income you can claim to get your treatments or even further surgeries or anything with regards to preventive healthcare. So what we are doing is in parallel, is in line within the sites of set by majority of the Ministry of Health and also by WHO. I hope that answers your question.
Yes, it did. Thank you, Jeevan.
Anyone else?
We still have time for one last question. Anyone else would like to ask a question? Please do so.
Yeah, because it's going to be 10.
Okay, I think if not, we shall end today's session. Before that, can everyone switch on your video and camera so that I can take a group photo? Come on, let's see all those faces. Okay. Okay, 1, 2. Cheese, everybody. Okay, thank you, everyone. Thank you for your time. I hope you all have learned a thing or two today. And for those who are new today, our next meeting will be informed in the WhatsApp group. So please ask the person who introduced you to today's presentation. They would be able to give you the details. Okay, with that, thank you once again, and good night, everyone.
Good night. Thank you.
Good night. Good night.
Good night, everyone. Bye.